What are modifier genes in cystic fibrosis genetics? Imagine two people with the same genetic mutation causing cystic fibrosis but experiencing very different health outcomes. How can that be? This difference is often due to something called modifier genes. These are genes outside of the main cystic fibrosis gene, known as the CFTR gene, that influence how severe the disease becomes. They don't cause cystic fibrosis themselves but can change how the disease appears in each person. The CFTR gene is responsible for making a protein that helps control the movement of salt and water in and out of cells. When this gene has mutations, it leads to thick, sticky mucus building up in the lungs and other organs. But even if two people have the same mutation in the CFTR gene, their symptoms can vary a lot. This is where modifier genes come into play. Modifier genes can affect many parts of the disease process. For example, some influence how the body responds to lung infections and inflammation. Genes like MIF, which stands for macrophage migration inhibitor factor, help regulate the immune response. If these genes cause a stronger inflammatory response, lung damage can be worse. Conversely, a milder response might lead to less lung damage over time. Other modifier genes impact how the lungs develop and repair themselves. Some genes help the lung tissue grow or heal after injury. Variations in these genes can mean some people experience more lung damage or bronchiectasis, which is a common complication in cystic fibrosis. Infection susceptibility is also affected by modifier genes. Certain gene variants can make it easier or harder for the body to fight off bacteria like Pseudomonas aeruginosa, which often infects the lungs of people with cystic fibrosis. This can influence how quickly lung function declines. Scientists use advanced techniques like genome-wide association studies and whole-exome sequencing to find these modifier genes. Some well-studied examples include genes that produce mannose-binding lectin to and transforming growth factor beta-1. These genes are linked to how severe lung disease can become. Understanding modifier genes is important because it helps explain why cystic fibrosis can look so different from person to person. It also opens the door to new treatments that target these genes or the pathways they influence. This research can lead to more personalized care, helping doctors predict disease progression and tailor treatments to each individual. It is crucial to remember that cystic fibrosis is a complex disease influenced by many factors, including environment and lifestyle. While modifier genes play a significant role, they are just one piece of the puzzle. Always consult healthcare professionals for personalized advice and treatment options. Studying these genes gives hope for better management and improved quality of life for those living with cystic fibrosis.